kidney failure, renal failure, or liver failure, or other findings that we are not going to study. You will study leptospirosis in the future, so we don't want to say anything else. So, many patients are very mild, they don't require treatment. Some patients may become more severe. If you want more information, you can check the presentation. Just to show you only some pictures of patients with leptospirosis. Look. Well, before that, this is the problem of leptospirosis. In Southeast Asia, we have leptospirosis in Vietnam, in the Philippines, in Malaysia, in Thailand, in India, a lot of cases. This is Indonesia. This is the island of Borneo, Indonesia. And in Southeast Asia, leptospirosis is an important problem. Look, and we finish with this. Look, in patients with leptospirosis, it's typical to find conjunctival suffusion. This is found in about 50% of patients. And what is this? If you have a patient from Vietnam that comes to the hospital with fever, with myalgia, with headache, and you think that the patient is suffering leptospirosis, this is conjunctival suffusion. Is this bleeding in the conjunctiva? This is conjunctival suffusion. In this patient, in this picture, we can find two signs. The first one, conjunctival suffusion, this blood here in the conjunctiva. But we find something else. The conjunctiva is yellow. This patient is suffering jaundice. That's another manifestation of severe leptospirosis, or this one is the same. In this patient, you can see two things. You can see jaundice, and you can see the conjunctival suffusion. This is a typical patient with leptospirosis. Conjunctival suffusion is found in 50% of patients. And we are not going to say anything else. Okay? So, any question about syphilis or leptospirosis?
Quick question.
Yes.
Did the gammas from syphilis same as abscess?
Yes. No, they are not abscesses. No, it's different.
Yes, thank
it's
you.
An infiltration of different cells, but it's not an abscess. More questions? No?
No.
Koha, do you want to say something? You want to explain something? About UBT, maybe? About UBT, VT? No? No questions? Okay, so we stop the class and we will continue the following day here in the class. Okay? So, goodbye and good luck.
Good luck.
Bye.